Hi guys, it's Dr. D. So in this video of teleradiology and second medical opinion, we're going to talk about subtle tibial plateau fractures. A very clinically important fracture which I've seen commonly missed in the emergency room setting. So let's jump into a case, an interesting case that I had. So first, looking at this x-ray, this is the frontal view of the knee. So as you can see, you do not see an obvious fracture in this case. Now let's look at the oblique view. Again, I do not see an obvious fracture. Now let's look at the lateral view. As you can see, there's a large knee effusion. More importantly, if you pay attention, you see that there's two different densities that are clearly delineated by the arrows. The two different densities actually go below the patella, if you see in this picture. The higher density is fluid, in this case blood, and the lower density is fat sitting on top. So what is this called? So this phenomena is called lipohemarthrosis. And what that means is lipo is fat, heme is blood, and arthrosis is joint. So how does this happen? So when you have a fracture of your tibial plateau, it means that the cortex is breached. And what happens is that the bone marrow, which is basically composed of fat and blood, shoots up into the joint space and causes you eventually to have a layer of blood and a layer of fat. So of course the fat is less dense, so that sits on top, and the blood is more dense, so that sits on the bottom when you take an x-ray. So even if a fracture is occult, the presence of lipohemarthrosis is indicative of a subtle fracture. So if you're in the ER, the next step that you need to do is to order further imaging, such as a CAT scan or an MRI examination. Usually a CAT scan is performed because that is faster and more convenient in the ER setting. So let's look at the CAT scan images for the same patient. As you see, I'm scrolling down the sagittal views. You can see by the arrows both an anterior and a posterior fracture line. So you have multiple fracture lines. And on the coronal, I can see the fracture lines along the tibial spines. So now looking at the axials, you actually see the fat fluid level, which corresponds to the findings you originally saw on the x-ray examination. So make sure you recognize the finding of lipohemarthrosis, as this is very clinically important so you can detect the subtle fracture and order further imaging so that appropriate treatment does not get delayed. Thank you for watching.